Hi, what is your name and what was your research question?
Hello, my name is Lucas Mortensen, and my research question was about the gender pay gap and women's inequality in healthcare.
Thank you. So, what are the main ways women are mistreated?
There are three main ways they are mistreated. There is a general lack of respect for women's pain. They are believed to over exaggerate their pain, and uh, as a result, they're often misdiagnosed and not taken seriously by doctors. There is a large research gap that has caused women's research on their bodies to be about 20 years behind that of men's. And oftentimes, male doctors, which are most doctors, tend to overpower the conversations between patient and doctor, which can lead to distrust between the patient and the doctor.
Thank you. Let's hear more about the research gap aspect.
Okay, so in 1977, the FDA published guidelines about excluding women from phase one and phase two clinical trials. This was in response to the thalidomide incident in the decade prior, in which many women in the Europe and Australia took thalidomide, and it caused severe birth defects because the effects were not known, and this caused the FDA to want to protect fetuses. And as a result, they excluded women from phase one and phase two clinical trials. This has ultimately led to them being significantly behind men just because we don't have the research that we do for male bodies.
What steps have been taken to close this gap?
Well, in 1993, Congress passed the National Institutes of Health Revitalization Act, in which they stated all NIH funded research must include women and minorities in order to help prevent health disparities throughout different like intersectional groups of people.
Interesting. Now, what are ways in which women are mistreated in clinical settings?
So they're mistreated in clinical settings in two ways. First one is their pain is just not believed. They are often believed to over exaggerate their pain, more prone to their emotions, that sort of thing. As a result, doctors just don't believe women. They will underprescribe opioids, overprescribe psychotherapy. This leads to a lot of misdiagnoses and overall worse health outcomes. Another way they're mistreated are doctors tend to overpower the conversation with a female patient just because of the culture about how women are perceived, and this will lead to the woman feeling like she isn't heard and causing her to ultimately seek different doctors and possibly alternative medicine.
Okay, here's a major question. Is there a difference between male and female doctors in treating patients?
This is actually a quite surprising find in my research. There is not a big difference between male and female doctors. Largely, they treat women roughly the same. All the data shows that there's no significant impact of physician gender on health outcomes. Uh, th- this is a really big shock because a lot of people would think female doctors would treat women better. But I believe this helps demonstrate that it's not necessarily individual misogyny, but more of a generalized misogyny throughout the whole culture of healthcare.
So, what was the ultimate conclusion of your research?
That women are severely mistreated in healthcare. There's way too many problems that we can't just overlook them. We got to address them right now, and without that, women will continue to suffer. They will continue to have worse health outcomes, continue to be misdiagnosed, and that's not what we want.
Thank you for having this conversation with me.
Of course, anytime.